Prani is a 83-year-old lady living with type 2 diabetes mellitus, which according to the National Public Health Partnership paper identified type 2 diabetes as one of the 12 chronic conditions that pose a significant burden in terms of morbidity, mortality, and healthcare costs in Australia. Prani is quite an independent old lady. She lives in her own home with her husband. She mainly mobilizes her wheelchair around the house due to loss of confidence after a surgery of hip replacement. However, her son and daughter are very supportive in assisting her with the housework and cooking. Prani usually stays at home all day and sometimes experiencing difficulty in carrying on with a good diet, maintain blood sugar levels, and taking oral medication on time. After the family has been noticed with the fact, they are overwhelmed and very worried about her condition and her risk of development of comorbidity. In this situation, Prani and her carer are in need of supporting education regarding client self-management of type 2 diabetes, behavior change, and rehabilitation to encourage clients in regaining strength and confidence in walking, to promote exercise and better quality of living. As healthcare professionals, we are able to involve in client healthcare management by following the National Chronic Disease Strategy document, which consists of 4 key action areas, include prevention across the continuum, early detection and early treatment, integration and continuity of prevention and care, and self-management. The National Chronic Disease Strategy provides an overreaching framework to strengthen Australia's capacity against the increasing prevalence of chronic disease, aiming to improve health outcomes and reduce impact of chronic disease, in collaborating to the National Health Priority Area initiatives for service improvement, which offer potential for significant health gain. In considering the National Chronic Disease Strategy, self-management would be the appropriate key action area to focus on for Prani health improvement and management of type 2 diabetes. Individuals who is suffering from diabetes need good commitment to self-management to achieve better health outcomes. Self-management is about people being actively involved in their own health care. The aim is to support client self-management by addressing gaps in her lifestyle, promote better quality of living by modifying and reorientating client house to better suit her needs, developing lifestyle choices, and eliminating barriers through prioritizing and planning appropriate care in consultation with client. Introduce client to all available support services such rehabilitation and physiotherapy, which would be beneficial for client in regain confidence in walking. Promote the participation of GP to review client health and treatment regularly. Diabetes Self-Management Guideline 2007. Self-management is a process of identifying client needs that require participation from client. Prani chronic condition requires significant commitment and involvement with activity. Self-management becomes the driving force in increasing client future health. Health professionals must be aware of the action area according to the National Chronic Disease Strategy and not to force the management of chronic disease. We also must have in our ability the skill of producing verbal communication, including psychosocial skill, understanding in the impact of chronic conditions, aware of community resources, and skill in identification of client strength, and ability to cooperating with healthcare teams to promote self-management for client, where client is being in the center of their own care to maximize their quality of life across the continuum of prevention and care.